Alright, so today we're going to be assessing an ankle and knee joint. With the ankle joint, we have two different joints. There's the talocrural joint, which does plantar flexion and dorsiflexion in the sagittal plane frontal axis. And we have the subtalar joint, which does inversion and eversion in the frontal plane sagittal axis. And then with the knee, there's the tibiofemoral joint, which does flexion and extension in the sagittal plane frontal axis, and then internal and external rotation, which occurs in the transverse plane longitudinal axis. So Isaac, what brings you in today?
I just have pain inside my ankle there.
Which side?
Oh, my right.
Right side, just right here,
Right
below your
here.
medial malleolus?
Yeah.
Okay. So with that pain, how bad does it hurt? 1 to 10?
Like a 6.
6 out of 10?
Yeah.
And describe what you feel with the pain.
Like a sharp.
Sharp pain?
Sharp pain.
Okay. So what we're going to start with is a toes to your nose. So bring your toes to your nose on both sides. Is there pain there?
Yeah, a little bit.
Same spot?
Same spot.
How bad?
This one's like 4 or 5. Yeah.
And then sharp again?
Still sharp,
Still
yeah.
sharp, okay. I'm going to apply overpressure on the non-injured side. Any pain with that? Okay. And then I'm going to go into passive on this side, so just relax. Any pain?
Yeah.
Right there? Okay, so empty end field because of pain, and less by about 10 degrees of dorsiflexion compared to non-injured side. Toes to the ground, please. Yes, pedal down. Any pain with that?
No.
Okay, overpressure here.
Good.
Good. Overpressure here.
Good.
Good. So equal plantar flexion on both sides. Both have normal soft tissue stretch. Soles of your feet inwards, please. Any pain with that? Any pain with that added? Any pain with that added? So overpressure, no pain reported. There is equal inversion on both sides with a firm tissue end feel on both sides. Last one, feet out that way, please. Pain?
Yeah.
Same place?
Yeah.
How bad?
This one's a 7.
7?
Yeah.
And then sharp still?
Sharp.
Sharp still, okay. So on this side, any extra with that?
No.
Okay, so normal end feel on the non-injured side with a firm tissue end. And then on this side, we're just going to go into passive. Tell me when it hurts.
Yeah.
Right there?
Yeah, it hurts.
Okay, so no empty or an empty end feel on eversion on the injured side, and the difference in degrees is roughly 20 degrees, 10, 15 degrees less on the injured side compared to non-injured side. We're going to do some isometric resisted testing now. So I'm going to pull this foot towards me. Don't let me move you. Any pain?
Nope.
I'm going to push this foot towards you. Don't let me move it.
Nope.
Any pain? I'm going to pull your ankle that way. Don't let me. Any pain? And then other direction. Any pain? Cool. 5 out of 5 on all of those. On this one, we're going to start with, we'll start with dorsiflexion. So I'm going to push your foot towards you. Any pain? No pain. I'm going to pull your foot towards me. Any pain?
No.
Okay. I'm going to try and twist your ankle that way. Any pain?
No.
Okay. I'm going to try and twist your ankle this way. Any pain?
No.
So 5 out of 5 strengths on those guys. No difference between either foot. We'll do goniometer measuring here on the ankles, starting with the non-injured side. The landmarks are rotation axis, lateral malleolus. The non-moving arm will go up the shaft of the fibula, and the moving arm will be parallel to the shaft of the fifth metatarsal. So starting with plantar flexion on non-injured side. Plantar flexion. We have about 60 degrees on non-injured side plantar flexion, and then we're going to measure dorsiflexion as well. So dorsiflexion. So dorsiflexion on non-injured side about 20 degrees. On the injured side, same landmarks. Starting with plantar flexion, or starting with plantar flexion. Let me know if there's any pain. Anything? Nope. Good. So inline. So plantar flexion on this side is about 70 degrees. And then dorsiflexion. Pain?
It's there, yeah.
Right there? Okay. So pain on this side with dorsiflexion. So we've got -2 degrees dorsiflexion on the injured side. We're going to move on to the knee assessment. So I'm going to get you to bring your heels up to your butt. Any pain with that?
No.
Overpressure on the non-injured side, any extra pain?
Nope.
Nothing. And then anything on this side?
Nope.
Awesome. Normal soft tissue stretch, both sides, no degree difference. Turn your toes inward for me. Any pain?
No.
You can apply internal rotation force, any extra pain?
No.
Internal rotation force, any extra pain?
No.
No. Normal firm tissue and feel there, and no difference. Toes out to the walls. Any pain?
No.
Any pain?
No.
Any extra pain there? Awesome. External rotation, normal, firm, and feels, and then no difference. And then extend your legs out again, and kick your legs up into my, or press your knees into my hands. Anything there?
No.
Awesome. Non-injured side, any pain?
Nope.
Injured side, any pain?
Nope.
So both equal, firm, rigid end feels there, equal degree. We will do some testing for you now here. So knees back up to your butt. And I'm gonna pull both your feet towards me, don't let me move you. Anything there?
No.
Awesome, 5 out of 5 strength bilaterally. I'm going to try and rotate your toes toward that wall. Don't let me move you that way. Any pain there?
No.
And then I'm gonna try and move you the other way. Any pain there?
No.
Same thing on this one, so we're gonna rotate you out this way first. Any pain there?
No.
And then the other direction. Any pain there?
No.
Awesome. 5 out of 5 strength on internal and external rotation, both legs, no difference. We're gonna do extension here. Kick up into my hand. Any pain? No. Other side. Kick up into my hand. Any pain?
No.
Awesome. 5 out of 5 strength, both sides. No difference there. And then you can extend your legs out. Awesome. We will do the goniometer testing for the knees. So starting with extension, axis rotation is now the lateral condyle of the femur. Stationary arm goes up the shaft of the femur. Moving arm goes down the shaft of the fibula with the fibula head as landmark. And extension first. So extension gets about 2 degrees of extension on injured side, and extension on the non-injured side. About 3 degrees, so about a degree difference there. Isaac, if you could flip over for me, we'll do some flexion testing. Starting with non-injured side, same landmarks, so lateral condyle, and we're gonna flex your knee. Any pain? Nope. Good. And we have about 170 degrees of flexion on that side. And on the injured side, any pain? Nope. Perfect. Injured side, a little less, about 140 degrees of knee flexion on that side. Can you flip over for me again? So we'll do some isometric resisted testing, or sorry, we did isometric resisted testing of your ankle already. So we'll list some indices here. So my first indice is a deltoid ligament sprain, on the medial side of the right foot. He's reporting pain in passive and active range of movement, but no pain during isometric resisted, and it feels relatively strong. So based on the location and then active and passive range of movement pain, I believe it's a deltoid ligament strain. Secondary indices would be a tibialis posterior strain. Now the only thing with that one is that there is pain in passive and active, whereas if it was a tibialis strain, it would be only in active. And then the final indice I have would be a medial malleolus fracture. But the reason that I'm not sure about that one is that with that you typically see pain in all inversion, eversion, patellar, and dorsiflexion, just because the movement of the tibia, fibula, and the talus.